Hi, my name is Tamara Malasov and this is head-to-toe video physical assessment. This is Sam, my husband, who agreed to be my patient for today's video. Before we begin, the patient emptied his bladder and the nurse outside put him in a gown and recorded his vital signs, his height and weight, and the Snellen chart was used to measure his visual acuity. I washed my hands and now we are ready to begin with the exam. First, I'm starting with inspection of his head. I'm looking at the symmetry, shape, and size of his head. I'm looking at the distribution and condition of his hair, of his symmetry of the cheekbones. I'm looking at the condition of his skin, the color of his skin. And now that I'm ready with, that I'm done with the inspection, I can start with palpitation. With palpitation, I'm using my pads of the fingers and I'm starting palpitating from the front to the occipital bone. I'm also feeling his hair. I can move his scalp freely over the skull, and his hair, there is a normal distribution. There is no alopecia. I can notice there is a little bit of balding, male balding in the crown area, which is normal for this age group. Now I'm starting with the palpitation of the temporal bones, and I'm moving to palpate his TMJs. Would you please open your mouth for me? Okay. When he opens his mouth, the patient can open 30 to 60 degrees. I am not feeling any locking, popping, or cracking feeling. Now I'm going to palpitate his facial bones. And now I'm also palpitating his frontal sinuses. There is no tenderness or pressure, and his maxillary sinuses. Now that you're ready with, done with palpitations, I'm going to start with the cranial exam test. So I'm going to ask my patient to clench his teeth, please, for me. Okay? Squeeze your eyes tightly. Okay? Wrinkle your forehead. Okay, thank you. Smile. Take your tongue out and go from one side to another with the tongue. Thank you. And puff your cheeks. Thanks. Okay, now we are moving to eye exam. With the eye exam, again, I'm starting with inspection. I'm looking at his eyes, at his eyebrows, eyelids, eyelashes, how they extend. I'm looking if there is any drainage. And I'm looking at the symmetry. I'm looking at the size of his, just take I'm looking, look at me, please. Thank you. I'm looking at the size of his pupils and the shape of his pupils. Now that I'm going to also check the lacrimal apparatus, palpating around his orbital rim. There is no swelling. And I'm going to check his conjunctiva, which is pink, which eliminates possible anemia. Now I'm going to start with pupillary light reflex. So I'm going to use the light pen and I'm going to bring the light straight to the patient's eye, left eye, to see if the left eye pupil constrict, which it's a normal finding. And now I'm going to use the same movement, checking his right eye for consensual pupillary reflex. Now I'm going to repeat the same thing from another side. Thank you. The next test is going to be covered and uncovered test. I'm going to cover one of patient's eye, and I'm going to ask him to look at the tip of my nose. Okay? And I'm looking at the lateral movement on covered nose, and there is no lateral movement, which is normal finding. And again, look at the tip of my nose. Thanks. Now we are going to check also extraocular movements of the eyes. I'm going to ask my patient to follow my finger in the 6 directions without moving his head. Thank you very much. Now that we are done with the eye exam, we are going to move to the ears. So again, with the ears, I'm inspecting and looking at the symmetry of his ears. We have to also, his eyes are properly aligned. So we are extending imaginary line from an inner canthus of his occipital inner canthus to occiput, and which is normal. And now I'm going to start with palpate. I'm also checking for any drainage, any redness. Everything looks good. And now I'm going to start with palpitating his auricles. So I'm pulling his auricles to see if there is any pain or tenderness. There is none. So now we are going to move with the otoscope. And with the otoscope, I'm going to check the inside of ear canal. So I'm pulling his pinna up and back to straighten his ear canal, and his tympanic membrane is pearl and gray. We should also do the same movement here. Thank you. Another is going to be, we are going to check for a whisper test. So I'm going to go behind the patient and whisper something in his ear.
Apple. Whisper.
The next test is going to be Weber test. We're going to do hearing. There is a test for a possible hearing loss. So I'm going to strike the fork, and I'm going to ask the patient if he's hearing better on left, right, or both ears.
Both.
Okay. Now I'm going to do another test called Ryan test. So this is a test that tests for air conduction versus bone conduction. So again, I'm going to strike the fork, and I'm going to ask my patient to give me the sign when he's not hearing anymore the sound. Thanks. The next test is going to be a test. We're going to check the patient nose. So first I'm inspecting, I'm looking at the patient nose to see if there is any deviation, and his nose is positioned in the midline of his face. Then I'm going to use the otoscope to see the inside, the mucosa, turbulates, and possible polyps. I'm also checking the midline, his nasal midline, which is normal. We are going to do a sniff test, so I'm going to ask my patient to obstruct one of his nostrils and try to sniff. Okay, do the same thing from here. Thanks. Now we are moving to the mouth, and again I'm inspecting. I'm looking at his mouth, his lips, the color of his lips. I'm looking at the angles of his lips. Possible cracks can show deficiency, vitamin B12 deficiency, iron deficiency, and possible anemia. I'm going to ask my patient to open his mouth. While he's opening his mouth, I'm just looking, I'm checking his buccal mucosa. I'm also checking his soft and hard palates, and okay, open your mouth. And I'm checking the floor of his bed. Okay, thank you. Now I'm going to ask my patient to open his mouth, take his tongue out, and say ah for me. Okay. With this one, I can check that his throat is open, so I can check the anterior posterior pillars. I can check uvula. You can close. Tonsils and hard posterior pharynx. And also, we can check at the same time, we're checking the condition of his gums, his teeth, if he's missing any, if there is any cavity, and if there is any dentures present. Now we are going to check for a gag reflex. So would you open your mouth? I'm going to check the posterior pharynx, okay? There's a gag reflex present. Okay, thank you very much. Now I'm moving to examination of the lymph nodes. So with the lymph nodes, I'm going to start palpitating. I'm checking preauricle lymph nodes. I'm checking the postauricle lymph nodes. Okay, I'm checking the occipital. I'm moving to tonsillar, submandibular, submental. I'm checking a superficial cervical. Okay, I'm checking the posterior cervical. I'm checking the deep cervical lymph nodes. I'm checking the supraclavicular. I'm checking the infraclavicular. And would you raise your hand? Okay. and I'm checking for axillary nodes. So they're not palpable, which is good. Okay. Now that we can move to the neck exam. So with neck exam, I'm inspecting, I'm looking at my patient's neck to see the symmetry, if there is any enlargement, bulging area. And now I'm going to ask my patient just to take a deep breath. Okay. Would you just swallow for me? Okay, I can see that his thyroid glands is also moving when he's swallowing. Okay, now, yeah, just relax. What I'm going to do, I'm going to also palpate for his carotid artery. Okay. So let's just palpate once at a time. Okay, thank you. And I'm going to check for his thyroid gland. So the best position is behind the patient. Okay. So his thyroid gland is normal. I'm also checking for a position of his trachea, which is in the midline, and this is also normal. Now I'm going to auscultate the possible bruise, and for possible bruise, and I'm going to auscultate for thyroid gland. For carotid arteries, I'm going to use the bell of my stethoscope, and I'm going to ask my patient to hold his breath. Thank you. Take a breath, please. Thanks. Now you can breathe. And now I'm checking now for thyroid glands. Okay. Thank you. We are going to complete the neck exam. I'm going to check the range of motion of his neck. So I'm going to ask my patient to flex his head. Okay, extend, put on the side, okay, another side, shrug your, okay, and I'm going to give you now resistance. So try to push, okay, good, okay, now back, okay, good, thank you, on the side, thanks, again, and I'm going to give you resistance with shrugging your, thanks. Now I'm going to move to upper extremities. I'm looking at his muscle tones, and I'm looking also his radial pulses, brachial pulses. I'm looking at his hands. I'm looking for the color. There is no, they're not pallor, there is no pale, so there is no anemia possible. And would you just do like this? Okay, I'm looking for a possible clubbing. So there is no clubbing, okay. There is a diamond shape. Thank you very much. A range of motion of upper extremities. Could you scratch your back? Okay. There is no problem with your shoulders, right? Okay. Now I can ask my patient to turn around, and I'm going to check the posterior of his thorax. Okay. Posterior thorax, I'm also inspecting. I'm right now looking at the patient's thoracic configuration, and I'm looking for his respirations. I'm looking at the rate, rhythm, depth, and effort, how he breathes. Obviously, he breathes, he's very relaxed. So now I'm also going to start with palpitation. So I'm starting palpitating his posterior thorax to see if there is any swelling, pain, no? And now I'm going to also check for his lung expansion. So with the lung expansion, I'm going to put my hands around his chest, and I'm going to ask my patient to take a deep breath. Okay, thank you. I can see that my thumbs are moving symmetrically here, just okay. Now I'm going to check for tactile fragmentus. So I'm going to ask my patient to say 99 every time when I touch you.
99. 99. 99. 99.
Thanks. I'm going to start with the systemic percussion. So and now that we are done with the percussion, I'm going to also, would you lift your arms. I'm going to percuss also laterally. Okay. And now I'm going to start, just relax. I'm going to check what is his diaphragmatic excursion. So again, I'm going to start with the precaution. Would you please take a deep breath and hold it, please, for me. Okay. And I'm going to mark this. And now I need you to exhale all your breath, all your air from the lungs and hold it. Okay, are you ready? Okay. And that will be his diaphragmatic excursion, and the findings are normal. He is within 5 centimeters. Now that I have his posterior thorax in front of me, I'm going to also check for his CVA, for tenderness. Do you feel any tenderness here? No, thanks. And the next step is going to be auscultation. Every time when I touch you with the stethoscope, please take a deep breath, okay? Thanks. Now I'm going to ask my patient to turn around. We are going to complete the anterior thorax examination. First, I'm inspecting. Again, I'm looking at the patient's symmetry, the rate, rhythm, depth, and effort of his breathing. And there is no deviations, everything looks normal. And I'm going to also start with palpitation. So first, again, we're going to check every time when I touch you, say 99, okay?
99.
Thanks. And I'm going to auscultate your lungs. Every time when I touch you with the stethoscope, please take a deep breath, okay? Okay. Okay. So now we can move to cardiovascular examination. I will ask my patient just to lay down, okay?
Which way?
In this way.
Like that?
Yeah, just over here. Here on your back. Okay. The cardiovascular examination, the head of the bed ideally should be elevated 30 to 45 degrees. When we are checking for JVPs, now that I don't have that angle, I'm going to ask my patient to look over there his left, and I'm looking if there is any JVP pulsation, and there is not, which is the normal finding. And again, I'm also looking, we can just look straight. Now I'm inspecting his anterior thorax. I'm looking at the precordium. I'm looking if there is any trills, pulsations. There is none. I can see that there is no scars on any kind of cardiac surgeries. And his skin is pretty much warm and normal. Now I'm going to check his apical pulse. Yeah. Okay. And I'm going to also check for any trills over the tricuspid mitral area. And I'm also checking over the aortic pulmonary area. There is none. I'm going to auscultate his heartbeats. Okay. I cannot any splinting, so S1, S2 is normal and there is no murmur. Now I'm going to check, I'm going to start with the abdomen. With the abdomen, first again we're doing the inspection. With inspection I'm again looking at the side to see if there is any peristalsis movement, if there is any masses, there is none, and any pulsation, everything looks normal. So I'm going to start with auscultation. So with auscultation I'm starting with the right lower quad. I'm checking also for aorta and possible bruise 1 inch above the umbilicus with the bell of the stethoscope. And just laterally, I'm checking for the renal arteries. Okay, I'm checking for the renal arteries. And I'm checking the femoral arteries. Okay, thanks. Now we're going to start with the light palpitation. I'm going to, while I'm doing this, I'm going to look at my patient's face to see if there is any signs of pain or tenderness. And the patient should tell me if there is a pain, okay? No pain? Okay. Now I'm going to start with a little bit deeper palpitation. So tell me again if there is a pain. Is there a pain? Okay. Now I'm going to start with systemic percussion, okay? And we are looking for sounds, tympanic versus dull. So when we have a dull sound, that means that we are hitting the organ. And now I'm going to also check for the size of his liver. So I'm going to start percussing. And I'm going to put the mark here. Okay. So we are going to see what is the size of his liver. His liver is 10 centimeters, which is normal finding. The liver size can be up to 12. I'm going to also percuss his liver, his spleen. And his spleen is not enlarged, which is the normal finding. Okay, now I'm going to palpate the edge of the liver. Okay, take a deep breath, please. Okay. And now I'm going to palpate. Take a deep breath. Okay. The spleen is here. Now I'm going to palpate. I can try to palpate his right and left kidney. Take a deep breath, please. Okay. I'm not successful because of the adipose tissue. Okay, take a deep breath. And again, we're going to do the same thing. Okay, thank you. Now I'm going to also check for abdominal muscles. So I'm going to ask my patient just if he can, just a little bit try to, okay? His abdominal muscles are okay. You can do that. And now I'm going to check the position of his aorta and pulsation of his aorta. Which is normal. Now we can move to the muscular skeletal exam. Now that I have a patient is laying position, I can see his legs. I can look, I'm inspecting the skin condition. I can see the hair the hair on his legs. I can also look at the possible muscle atrophy and muscle strength. Now I'm going to ask my patient to, if he can just push, okay, thank you. So his muscles are okay. I'm going to palpitate. Okay. I'm going to palpitate for edema around his legs, which is none. Okay. I'm going to palpitate his dorsalis pedis pulse, his posterior tibial, okay, and I'm checking for palpital pulses. Okay. Thank you very much. I'm going to check also for sensation. So would you close your eyes and tell me if you can feel sharp or dull sensation?
Sharp. Dull. Sharp. Dull. Dull.
My patient doesn't have a diabetes, but then in the case that we have a patient with diabetes, we can also check with the filament test here. Okay, you can feel this?
Yes.
Okay. Now I'm going to ask my patient to sit. Okay. And I'm checking for reflexes. So first I'm going to check for a brachial reflex here, okay, which is positive, which is normal finding, okay, thank you. I'm going to check patellus reflexes, okay. And now I need you to sit around and just put your leg like this. No, actually, just turn around and put your leg like this. Just knee, okay, just do it, be in this position, yeah. Okay, and just relax your, okay, and I'm checking his, okay, I'm checking his acromion reflexes. Now you can stay in this position. I'm going to look at your cervical spine, and would you bend your, okay. You don't have any pain, any tingling in your arms or pain, okay? No. And now I need you now to bend a little bit, okay? Do you have any pain?
No.
Okay. And I'm also checking his posture, if there is any kyphosis, possible lordosis a little bit, but everything looks normal. Okay, thank you very much. That was my head-to-toe physical assessment video, and thank you for watching.